reference plus 5 standard deviation, we used to measure reference plus 2 of the standard deviation, drawing the endocontour and the epicontour, and you could draw areas of enhancement, areas of MVO, as well as any areas of edema, which is the area at risk. And if you subtract area at risk, which is the area of the edema, minus the infarction size divided by the area at risk, would give you the salvage index, the percent of the myocardium that could be saved by the PCI. For example, in this case, so we have a reference in the normal myocardium. This is the infarction size, and on the right side panel, as you may see, this is the edema area, and at the bottom the late enhancement was 27 grams, the T2 was 46. So if we say 46 minus 27 divided again by 46, we could give, or we could calculate the salvage index. Of course, there are many other complications that MRI could comment on, but I think we have discussed the main domains so far. Those are rare complications that sometimes could happen. For example, aneurysms with a thrombus or pseudoaneurysms, detection of any pericarditis, as you may see the whole enhancing pericardium, thrombus or thrombi, whether in the right ventricle. This case is not ischemic case, but it's just to raise the awareness of that it could, or it's possible to see a thrombus on the right ventricle as well. Left ventricle or an apical thrombus is important to detect. And here are some cases that we have measured the salvage index. For example, this case 1, where there is occlusion of the coronary artery, LCX, and a large edema or large area at risk, a large MVO, and large infarction. Another case where the LAD here, there is obstruction, RCA was fine, and the PCI TEMI flow, a successful TEMI flow would be 3 and above. As you may see here, the lumen patent now after the PCI. Here's the area at risk, which is a large area at risk extending from almost the base until the apex. This bright signal as compared to the lateral wall. So the LAD territory is showing edema, so it was a large area at risk compared to, this is the MVO, so this is the early enhancement showing a large area of early enhancement and MVO. The late enhancement, so the areas of the late enhancement is smaller than the area at risk that we saw in the edema sequence. So there is, or there was a large area at risk in this case. This is the follow-up of the same patient. Edema resolved. That was 6 months after the first MRI. As you may see here, the area that showed transmurality or transmural infarction now is thinned out, and remodeling in this patient started. And this is his first MRI post-infarction on the left side, middle after 6 months, and then after 18 months on the right side. And as you may see that the size of the left ventricle, this is the remodeling and adverse effect. So the size of the left ventricle now is dilating across the time. The myocardium in the LAD territory, so the apical and the septum, is thinning out. Function is decreasing. This patient was admitted twice because of heart failure. Another case, PCI, and large MVO, large myocardial infarction, large area at rest, large areas of edema, functions of course impaired, and this patient showed MVO, transmural infarction, and his salvage index was around 37% when it was calculated. The left ventricle was mildly dilated. This patient didn't come for a follow-up in MRI, but so far he was not readmitted for any heart failure. Probably in the echoes there was no dilatation or there is no progressive remodeling. Any questions?